Hello, I'm Congressmember Judy Chu from California's 28th District and chair of the Congressional Asian Pacific American Caucus, or what we call CAPAC. I want to start by thanking the Stanford Center for Asian Health Research and Education for the invitation to join this critical discussion. It's a pleasure to virtually participate in this Gastric Cancer Summit, which is bringing together so many healthcare experts and researchers invested in raising awareness to this often deadly disease. Unfortunately, too many in our communities are unaware of the reality that you, as providers, researchers, and advocates, see every day, that Asian Americans, Native Hawaiians, and Pacific Islanders, or AANHPIs, are especially susceptible to gastric cancer. In fact, AANHPIs are the only racial or ethnic group in the U.S. for which cancer is the leading cause of death for both men and women. According to the American Cancer Society, while Asian Americans overall have lower cancer incidence and mortality than the general population, they have the highest rate of stomach cancer, about double those of white Americans. And in certain ethnic populations, such as persons of Korean, Japanese, Chinese, and Vietnamese descent, stomach cancer rates can be up to 3 to 5 times higher. But despite this elevated risk, AANHPIs are generally screened for cancers at lower rates than the majority of Americans. For years, CAPAC has been united in our efforts to increase awareness and funding for solutions that address gastric cancer, including hepatitis B vaccines and treatment. This is because while AANHPIs make up 7% of the total U.S. population, we account for nearly 60% of those living with hepatitis B. Like so many AANHPIs in the United States, I have lost friends to this disease. Before coming to Congress, I had the honor of supporting a longtime community activist, Chi Moy, in his run for city council in the city of San Gabriel, California. When he won, he made history as the first Asian American to ever serve on the San Gabriel City Council, and the community rejoiced in the success of such an excellent leader. But one day in his 40s, Chi tried to donate blood and discovered that he had hepatitis B. 2 years later, it turned into liver cancer. We watched as Chi grew more fragile and as he fought the disease valiantly, hanging on until he was sworn in as the first mayor of Asian descent in the city's history. But just a month later, he died at the age of 53. I share my friend Chi's story to show how important it is to make sure that those who are susceptible to this disease get tested. But the real tragedy of Chi Moy's story is that it did not have to happen. Hepatitis B is preventable through a vaccine, and it's also treatable. However, because there is so little awareness surrounding this virus, 2/3 of those who have it don't even know they are infected. What's even worse is that many don't become aware of their condition until they develop symptoms of gastric or liver cancer or liver disease, and by then it's often too late. So in Congress, my fellow members of CAPAC and I have made it our mission to raise awareness of this disease and increase funding for testing and vaccines. And I'm proud to say we have begun to make progress. In addition to raising significant awareness of hepatitis, we have increased federal funding by $2 million for a total of $41 million in annual funding for the Center for Disease Control's Division of Viral Hepatitis, which can conduct initiatives like a national vaccine strategy for hepatitis B. And I believe we can do the same with gastric cancer. In fact, I'm proud to be a co-sponsor of a new bipartisan bill led by Congressmember Yadira Caraveo, the Stomach Cancer Prevention and Early Detection Act, which would direct the National Cancer Institute to conduct a review of the current state of stomach cancer in the U.S. and provide recommendations for promoting stomach cancer prevention and early detection efforts. This would be a great step toward raising awareness of gastric cancer's impacts on our communities. I was also proud to join my Tri-Caucus colleagues in introducing the Health, Equity, and Accountability Act of 2024 earlier this year, which would increase cancer prevention and treatment in communities of color by working with community-based organizations to ensure culturally and linguistically appropriate access for individuals with limited English proficiency. But let me be clear, the major disparity in cancer rates is disturbing, and it is unfortunately not unique to stomach cancer. The successes we have fighting disparities in stomach or other cancers don't happen from congressional efforts alone. They are achieved through all of you here today who are working tirelessly to end health disparities. The Center for Asian Health Research and Education, along with the advocates, researchers, patients, and doctors like you, who uplift AA-NHPI voices around the impacts of gastric cancer on our communities, are essential. So thank you again to CARE for hosting this critical summit, and I look forward to working with all of you to build a coalition around eliminating the gastric cancer health disparity for AA-NHPIs and ultimately winning the battle against this cancer in the U.S.
Good afternoon. It's a pleasure to join you today. I'm Dr. Yadira Caraveo, and I'm proud to represent Colorado's 8th Congressional District. As a physician, I have been concerned about the health and well-being of not only the people in my district, but all Americans. We need more and better resources to prevent and identify stomach cancer, an uncommon yet still catastrophic type of cancer. As a member of Congress, this has meant collaborating and working in a bipartisan way to address this head-on. It's why I was proud to introduce the Stomach Cancer Prevention and Early Detection Act, a bipartisan bill that would conduct a review on stomach cancer and gain further insights on how to best prevent and detect this fatal disease. In Congress, I will continue to work to raise awareness about the importance of screening, early detection, and treatment. It is very important that you, as patients, providers, researchers, family members, come to us as policymakers to tell your stories. These can translate into action which can protect all Americans. Thanks again.
Good afternoon. I am so sorry I'm not there in person, but I am excited to pre-record these remarks for the Gastric Cancer Summit and speak to this incredibly important audience. I am Anabella, and I lead public engagement for the Biden Cancer Moonshot. For those who may be less familiar with our work, almost 3 years ago this February, President Biden and First Lady Jill Biden reignited the Cancer Moonshot and set 2 ambitious but achievable goals. The first is to cut today's age-adjusted death rate from cancer by at least 50% in the next 25 years, preventing more than 4 million cancer deaths by 2047. And the second is to improve the experience of patients and their caregivers living with and surviving cancer today. As this group well knows, around 27,000 individuals are diagnosed with stomach cancer in the United States each year. While stomach cancer would be considered a rare disease, representing 1.5% of all new cancer cases, stomach cancer is a leading cause of cancer death globally. It is likely that everyone knows someone who has been impacted by this disease. So while challenges remain, the Biden Cancer Moonshot is working through our cancer cabinet and through collaborations with the private sector to tackle these challenges head on, including shortening the time to accurate diagnosis, working to reach more people with the tools we already have to diagnose and treat cancer, and driving new discovery and development of effective therapies. In recognition of November as Stomach Cancer Awareness Month, President Biden has issued a written message to the community. I want to close by sharing some of his message. During Stomach Cancer Awareness Month, let us recommit to doing all we can to provide patients, survivors, and their families with the treatments, care, and support they need and deserve. Let us rededicate ourselves to the urgent work of increasing awareness about stomach cancer so that we can save more lives more quickly. And let us never lose hope or waver in our resolve to end cancer as we know it for all the lives lost and for all those we can still save. Thank you again for listening to me and letting me share some of the work of the Biden Cancer Moonshot with you. I look forward to hearing how this summit goes. And on that note, we always want to hear from you. Please visit our website, whitehouse.gov/Cancer Moonshot to get in contact with us. Thank you again for your work and dedication.